Moving forward, signs and symptoms, the same way the risk factors of breast cancer if you discuss. So when it comes to signs and symptoms, unfortunately, like I told earlier, so earlier stages, unlikely a patient or an individual or a woman would identify breast cancer. And also to set, to mention, when it comes to male female, there is a chance of male person can get breast cancer as well, and but it's a very small chance. So 200 is to 1 is the ratio when it comes to male female ratio when it comes to breast cancer who a man would get. So mainly we are focusing on females. If we are referring to females, if in early stages, unlikely they would identify a breast lump or changes, etc., etc. But anyway, normally a presentation a female would present with when it comes to breast cancers, there can be mainly three stages, as in three ways. One is they can have accidental finding of a lump in unilateral, that means only one side of the breast. Unlikely they would have it in both bilateral breast lumps, okay. And also, even if there is a bilateral, if there's going to be a bilateral breast lump, they're unlikely it's going to be the same size and uniformed. So maybe when you're changing, when you have a shower, accidentally you find a lump in your breast, and you present to the GP or to your doctor to find out what that is. That is first thing. The same way it can be skin changes. So skin changes can be basically, again, you notice yourself, there can be redness of the skin, or it can be puckering or dimpling of the skin, so things like that. So that might be alarming for you to find out whether there are any problem, to find out or to go and ask for medical help. And the third thing can be the nipple changes. So that is inverted nipples, displacement of the nipples, all of a sudden. These can be also a significant symptom of breast cancer. When you look at it, you find it, and you go to a GP. Apart from this, almost always the breast cancers, the lumps, are painless. It's not a painful lump, okay. So that is also when there is no pain, you might give less attention to the lump, so you might not seek medical help. So that also can be a problem. So these type of things can be the basic symptoms of symptoms and signs of breast cancer. And there can be, again, from discharge from the nipple. Discharge means it can be blood discharge from the nipple, so etc., etc. There are so many, but then again, more refined, if I look at it, it can be the skin changes, and then you're looking at the sudden onset of a lump, accidental finding, or you have identified, or it can be the nipple changes, right? So when you look at the risk factors of the breast cancer, almost always, mostly the risk factor you will look at is going to be a genetic, as in a family history of breast cancer. There are a couple of stages. If it is a closest relative, and then the person who's who's not very close to you, but still, if there is a higher risk factor, if you have a closer relative, your mother, father, a blood relation who has a breast cancer, then you are in high risk of breast cancer. And also, you're looking at early menarche, you have got a puberty, or you have had your first periods very early, less than 12 years of age. That can be one of the reasons. And then you can look at late menopause, after 55 years of age. Still, you've had your last onset of periods after age of 55 years can be a problem. So these type of things. And apart from that, hormonal issues, like if you more than 5 years of duration you have used OCPs, which is like oral contraceptive pills, this can be an issue. This might trigger breast cancer. And the same way, if you're looking at the menarche and menopause, which I mentioned also, which will fall into the hormonal stages. And also, if you're the main risk factor can be smoking. Smoking can be one of the risk factors. And also obesity, you have excess weight, you're not within your BMI, so this can be a risk factor. So there are a lot of risk factors which involves in breast cancer. So one of the main things you have to look at, you need to be alarmed about, I would say, a family history. So if you have a family history, it's better for you to have after certain age, for you to make sure that you have gone and checked yourself and all, you are in line and you're alarmed about. This can be one of the main risk factors for you to be alarmed about.